examining a horse's foot, a front foot, just get the horse to pick the leg up, obviously pick its feet out. Okay, I'm not going to do that today.
So you use the knife for
yeah, you use the knife to pick out, or a specialist hoof pick.
Yeah.
And then what you should do is actually put the leg, if it's a front leg, you put it between your own legs, okay? And then you go round the leg with the hoof testers. So you go round, or round the foot with the hoof testers, so you go all the way round. I mean, get used to putting these on. And you have to put them on quite firmly, you know, that amount of sort of pressure, okay?
Yeah, yeah.
And this is to look for sore spots on the horse's foot. Then you go all the way around. And then what we do is put it over the bulbs of the heels like that. And then you go into where the frog is. This is a bit mucky. Just there. And you should be putting a bit of pressure on. And the same onto this side of the frog. And just be careful you don't hurt the coronary band. Don't put them so high up you nick the coronary band. And this is also how you would take a shoe off as well, obviously, okay? If you're doing a hind foot, I'll just quickly show you how to do one of them. Hind foot's a bit different. Lift the horse's foot up and just rest it on your knee, okay? Do not have it between your legs, alright? They're rather sore.
Is it that important, like, because sometimes you do it your way, like, you lift the leg the way you think it's okay, or is there, you have to follow like specific?
Yeah, I would just, the easy way to lift a horse's leg is just to approach and just touch here.
Yeah.
Most of them are conditioned to lift the foot up for the owners to pick the feet out. Some horses don't, you know, pick the foot up, and if that's the case, then you just have to pinch it slightly and they will lift it, okay? So the next thing to do would be to actually lift once you've got the leg lifted, you've checked the feet, is then to actually have a feel at the tendons and ligaments. So you can actually feel them. I'll get you all to pick up the leg and have a feel, but you can feel the superficial digital flexor tendon straight away. Directly below that we have the deep digital flexor tendon. When we're up in this region, we've also got the check ligament. We then go into the suspensory, and you can follow the suspensory all the way down until it's branches, just at the fetlock. Okay. Check the range of movement of the joints.
So mostly like along the cannon bone, that's that you can't like feel them up or down.
Yeah, feel them up and down. Yeah. Check the range of movement of the joints as well. Okay. So we do that. If you're doing a flexion test, then what you would do is you would if you're doing a fetlock in the front leg, we put our hand on the cannon bone, one on the hoof, and we bend like that, okay? And we do that, it should be firm, and we do that for 30 seconds minimum, ideally 1 minute. So I would always encourage you to flex for a full minute. If you were doing a carpal flexion test, like that, okay? If you're doing an elbow, then like that. Hind limb. What we need to do with that is the hind limb sort of flexes as one unit, I'm afraid. So what we tend to do with the hind limb is pick it up. This is for flexing the hind limb. Stand straight, and you can see everything flexes. And again, do that for a minute. Some old-fashioned vets call that a spavin test. Okay, and that's because it's flexing the hock. So you wouldn't do flexion tests as part of a normal clinical examination. You would do flexion tests if there was a cause for concern regarding the horse being lame, or if it was part of a pre-purchase examination. And then what they might ask you is, you know, what are your opinions on flexion tests as part of a pre-purchase examination? And the answer would be that it's quite a sort of grey area, okay, in that some vets, you're not obliged to do it, okay? I think it would be daft not to do it, but it's almost like what I would sort of describe as a crystal ball. You're trying to predict a potential problem by seeing if the horse will go sore from flexing it. So it's designed to make a potential mild problem appear more obvious to you during one of these examinations, okay? And what I would sort of say is that if the horse, most horses, or a lot of horses, if you flex the leg hard enough, will all go lame to a degree. What you're looking to do is to see just how lame they go. Now, I usually give them about 3 or 4 steps when they're trotted off to shake off that lameness. If they're still lame after 3 or 4 steps, then I think that is a significant finding. Okay? Particularly if it's a young horse that you're getting it in, obviously there shouldn't really be any problems with joints in a young horse, so often that can be of more significance. Okay? Pre-purchase examinations are not a day one skill. Okay? So I would be familiar with the process of them, however I wouldn't sort of be expecting you to be able to go out and do these in the first day of the practice. Yeah, it's a popular one for them to do because they can cover a wide variety of areas with it. So that